Good evening and welcome to our Ask Me Anything session for oral surgeons. I am Veronica Figueroa, Director of Specialty Support at Aspen Dental Management. And we're excited to spend the next 45 minutes or so answering as many of your questions as possible. Before we get started, let us review how the questions will be taken. At the bottom of your screen, you will find the Q&A function. Please type your questions and we will make sure to cover as many as we can during our time together. Let us have fun with this and get as much information from our panelists as you want. You should know that between both of our talented panelists, Dr. Tin and Dr. Patel, we have over 15 years of Aspen experience. It does not get any better than that. So our goal tonight is to help you understand more about our specialty model and how you can play an integral part of our Aspen family. So before we begin taking questions, I want to give the opportunity to each of our panelists to introduce themselves. Where do they live? Where did they attend dental school and residency? And how long have they been with Aspen? So let's start with Dr. Tin, and then we'll have Dr. Patel also introduce himself.
Hi, everyone. My name is Paithan Tin. I am an Aspen oral surgeon. I was born and raised in Los Angeles. I did my undergrad at USC. I moved to New York and went to Columbia for dental school and did my training at Montefiore Medical Center in New York City. I've been with Aspen about 12 to 13 years now. I have 17 practices in the Western New York, Central New York area, which would be Buffalo, Rochester, in that area.
Thank you.
Mm-hmm.
And Dr. Patel?
My name is Chintan Patel. I was born and raised in India. I came here in 2007 and attended New York University College of Dentistry. And then I finished my residency from Montefiore Medical Center in Bronx, New York in 2019. And I have been with Aspen for about 18 months. And I cover Columbus region and north of Columbus, and I have about 14 practices.
Great. All right, so let's get started with the questions. Our first question is, did you join Aspen straight out of residency or did you work somewhere in between? If you came straight out of residency, did you feel you were prepared to take on difficult cases on your own without a mentor oversight? Dr. Patel, why don't we start with you and then we'll ask Dr. Tin to join.
Yes, I joined the Aspen straight from residency, and the kind of training that I got at Montefiore Medical Center, I think I was prepared for doing the regular dental alveolar cases, IV sedations, and wide varieties of dental alveolar cases by myself.
Okay.
Do you want me to?
Yeah.
Oh, well, I actually practiced in private practice for a year and a half before I started Aspen. So I felt pretty comfortable handling all the complications that might be associated with doing oral surgery in a multi-office practice. You're definitely going to be well-trained. You'll be prepared to handle things just like you would in your residency. It's very similar setting. So I think you should feel very comfortable coming straight out of residency.
Great. How did you manage job searching while in residency? And how did you know you were ready to make the decision?
Who is that for?
Whoever wants to take it.
Well, my situation was a little different. I come from a family of dentists and oral surgeons. My sister's a dentist. My brother-in-law is an oral surgeon, plastic surgeon. They all practice in San Diego, California. But I ended up staying on the East Coast. So initially I was supposed to go back to the West Coast to work, but I ended up meeting my wife. So a lot of the residents when we were looking for jobs, we had some job searches, and Aspen Dental had come up, and some of my friends had worked there before and they loved it. And I basically got an interview in Syracuse, and we went up there to to see how the practices were run, and that's how it started for me.
Dr. Patel.
Yeah, I did my research, and I interviewed with a couple of private practice guys, but what happened is that they want to hire you, and then they just want you to market yourself and build your own practice. So, I think after going through a couple of experiences and then having interviewed with Aspen, I just decided that at this stage in my life, I think the best thing is to join Aspen, where I can get the proper support. Means there's so many things that can go around to run a practice. It's just not surgical skills. A lot of things that can go around to make you a successful practitioner, and I think Aspen provides a great non-clinical support.
Well said. How do program directors, chiefs, or other colleagues perceive your decision to pursue a career in corporate setting compared to a more traditional private practice or hospital-based work?
Well, I think that, we come from a program where there's many people that have started working from Aspen. It was actually my chief resident was the first one. He was one of the original oral surgeons at Aspen, and me and my co-resident actually decided to also pursue it. I think that when you're looking for a job, there's a lot of things that you need to look for, and you have to find a job no matter where it is in life. It could be here, it could be at another facility, it could be in private practice, but a job that suits you and helps you be better at the skills that you are and support the ones that you're not so good at. And when I was looking at jobs, I really felt that the support system that's around allowing you to practice oral surgery and not worry about the other things on the side, which are supported by the specialty crew and Aspen Dental, it was a good fit for me. I've been here 12 years. I've been very successful in my practices here. I live a very great life, balanced life. I don't live just oral surgery. I live a very balanced life, and I owe a lot of that to working here at Aspen Dental. So.
What would you say, if you could, kind of summarize it to one or two, what would you say are the pros and cons of working for Aspen?
I think a couple of the pros would be, I think we have a lot of financial freedom. We're able to set our schedule. The cons would be, there is some travel involved, so you have to be okay with the travel. But we set our own schedules. We have people that help us through processes like billing. We have people helping us with supplies. We have things with our malpractice. We have all these things that are all pros to me because I'm really not that great at those things. So it really helps me focus on my patients and focus on doing oral surgery, and then also focus on my family. So those are important to me.
Anything you want to add, Dr. Patel?
Yes, same thing. Just want to focus on the surgery, so that's one of the most important thing, is that I just want to take care of the non-clinical stuff, marketing myself, and just want to do what I love, doing surgeries. And yes, of course, the traveling sometimes can be a little bit hectic, but once after 6 months you get used to it, and after that it just doesn't bother as much.
Okay. I like this question, and I'm assuming it is coming from the introduction. It says, 14 and 17 offices seems like quite a few to keep track of. So who is responsible for orchestrating and managing the schedule to ensure each office gets appropriate chair time for the surgeon? If the schedule is managed by someone else other than you, are you able to have input on what patients you are seeing, treating on any given day?
I have 17 offices. Because of my territory is set up the way it is, there's some days where I can go to more than one office. So I can go to one office in the morning and I can go one office in the afternoon. I 100% manage my own schedule. That's important to me as well, because there might be time that I need off. Believe it or not, I have 17 offices and I take the first week off of every month. So I have full control of my schedule. The way that I work my schedule is based on need. So once you get into the flow of working, you'll understand which offices need more time, which offices need less time. And you'll see it just becomes pretty set after you've been doing it for a little bit, that you'll understand the process, and it's very efficient and you have complete control.
Dr. Patel, anything different that you do? I mean, you have a full-time market as well, not at 17 offices, but you also have a full-time schedule. So how do you manage that?
Yeah, so we control our schedule. So I make my own schedule. But once we get the schedule out, we have our set preferences that all the office managers and the regional managers, they know how much time we need for each procedures, and you know, what things can be booked on the side column and stuff like that. And also I check my schedule every week, 1 week in advance, so that, you know, if I see any discrepancy, I can just let the office manager know and they can fix it for me.
I think that's important what he said. Said every oral surgeon that works for Aspen has a profile on the web page. We all have a web page where all the office managers, all the staff at these offices have access to. And what that does, it gives them a template of how we like our patients seen, how we like things scheduled. And it helps just create a good flow for us. And if there are any discrepancies, we call them and we can discuss them. Or if they want to do something else, they give us a call. We have, you know, you have to build these relationships with these offices so that you're able to create these schedules. And but the majority of things are, we set our preferences, we fill out these paperwork. They tells us how much time we need per procedure. It also tells us how what procedures we do, what procedures we might not do. So it gives us a set preference prior to help these offices build you schedules with the proper amount of time.
That actually leads us right into the next question. What types of procedures are you doing at these practices?
You want to go, Dr. Bill? Yeah, it's up to you.
Yeah, go ahead. I'll take that. Just usually a dental alveolar, like wisdom teeth, full mouth extractions, some biopsies, and dental implants, and, you know, some grafting and stuff like that. So just regular dental alveolar and dental implant procedures, IV sedations, and local anesthesia.
Follow up. Do you do any sinus lifts?
Yes.
Yes.
Okay. And then do you treat many patients with anesthesia without prior consultation? And if so, do you feel it is in any way a compromise to their safety?
Well, you know, patients are pre-screened prior to us getting there. As the patients are scheduled, you remember, they're also seeing a general dentist who's going over the medical history. And if there's anything seen on that medical history that raises a red flag, a medical release is completed, sent to their primary care doctor, cardiologist, or whoever the doctors that are needed to be. They're filled out with a response. And then at that time, like Dr. Patel said, a week in advance, we're able to review these charts so that we're able to answer some of these questions prior to. So most of the time, obviously, it works out where we're able to give great care as well as being safe and making sure that we looked at every possible scenario in terms of the medical history and make sure that the patient's going to be safe. So that happens prior to, and we're all very good about that.
Yeah.
Were you going to say something, Dr. Patel?
Yes, you know, that's why you know, even if we work in Aspen Dental, that doesn't mean that, you know, we don't have good communication with our general dentist. You know, we build a relationship with them. You know, every time we go in there, we have like a chat with them for a few minutes, and, you know, then they know the oral surgeon, and we know them, and then we create a relationship where they know when to send the medical release. And sometimes if they have any questions during the day when they are seeing a patient for a consult, or when the patient comes for an exam, they usually send me a text, and, you know, we can discuss the case, and we can proceed further. But you know, we do take care of our patients very well. Like we take care of the patient like, any other oral surgery practice. We look at their medical history, we send the releases, and we follow all the protocols, and we have all the emergency equipments and all the necessary stuff as per the state requirement for safe anesthesia practices.
That's a great segue to the next question. Do you have to go through a state anesthesia site inspection for every office at which you practice? And I know this is going to be dependent on the state. So who wants to go first?
Well, in state of Ohio, we don't have to go through the inspection for each office, but the inspector come to one office and they will check all the emergency equipment, anesthesia equipment, and we have to do a live, like couple of patients for sedation, and then they will certify us. But we don't have to do it for each office.
Correct.
Are the clinical staff that you work for DAN certified? And would the clinical staff at other locations have this certification?
I travel with my assistants, so my assistants accompany me wherever I go. There is a dance certification process that we sponsor our assistants for. I'm actually, my assistant of 10 years has just stepped down because it was too much for her. She was getting a little bit older and she didn't want to travel as much. So I'm just hired a new assistant actually in the last couple months, and we're in the process of getting her sponsored to get the certification. So yes, I always have the same assistants traveling with me. So I would believe you would too, or the same ones within the practices that you would travel to. So that is definitely an option and encouraged.
Absolutely. And every state has its own requirements. But as Dr. Tin mentioned, we do offer the DAN certification reimbursement program for our dental assistants, which is pretty unique. When we talk about logistics, this is a good question. What is the furthest office you travel to? As far as distance?
For me, it's 2 hours.
Out of my 17 offices, 15 are within an hour and a half to hour and 15 minutes. I do travel to an office that's 2 hours and 15 minutes away. I only do that once a month, and that would be the farthest that I drive.
And what does your typical day schedule look like for you? How many patients are you typically seeing, and how many hours are you working in addition to your travel time?
I don't have extended days. I work the office hours. So it's usually 9 to 6, 8 to 5, something in that, with an hour lunch. And depending on, you like we said, we have a preference sheet of how many patients we see. So depending on how long it takes you to do a certain procedure you feel comfortable with, your schedule is set that way. If it's an hour, if it's 45 minutes, whatever you choose, those are how often you would see a patient. So that's 5 or 6 patients in the morning, right? 45 minutes to an hour, and same thing in the afternoon.
Anything you want to add there, Dr. Patel?
Yeah, days are from usually the office hours are 8 to 5 or 9 to 6, and I see about like 8 to 9 sedations and a few consults and couple of local cases usually. And some days are busier, but this is how on an average the average day looks like.
And how many, since these are not specialty practices but dental practices, how many operatories do you work out of in each of these locations?
I work out of 2 operatories side by side. Some days are busier, then I might ask for the third one, but usually I occupy 2 operatories in our office.
I usually take between 3 and 4. I use 1 as a recovery room. I work out of 1 sedation room, and I work out of a local room as well. So that's usually the number of rooms I have.
And since you are traveling, who's handling the sterilization of your instruments and equipment?
Our assistants.
Yeah, our assistants.
And where do you get your referrals from? And what are the benefits of working with the general dentist in the same office that you're treating patients at?
Well, 95%, I would say, between 90 and 95% of my patients are Aspen patients that are referred by the general dentist within that location. It's a great system. You're able to communicate, if you have any questions regarding the treatment plans of the patient, the dentist is right there for us to, discuss it. If you don't agree with the treatment plan, or you want to discuss and make sure that what they're trying to achieve, that, that's what we're working towards, we're able to discuss that. So I think it's a crucial benefit to be able to have a dentist. We have a lab tech in there that's able to also make sure that any dentures that are being delivered are matching. So there's a huge benefit to having all parts of the puzzle in the same location to benefit the patient. So for sure.
Anything else or anything different, Dr. Patel, you would like to add? Or
It's about 95% patients are Aspen patient, but now I'm seeing a trend here in my region is that, there's a barrier to care where the private practice patients are coming with the outside referral too now that, like especially during the summertime, the wisdom teeth cases, I'm seeing a trend there. I'm seeing a lot more from the outside practices.
And as you mentioned before, you don't have to go solicit those referrals. They're coming to you either from our marketing or insurance carriers, which is pretty nice. This is a good question that just came in about hospital privileges. Do you maintain hospital privileges at any locations? And if so, is there an established pathway for bringing patients to the OR if indicated?
I don't have hospital privileges. I guess everyone chooses in their career which path to take. I personally don't want to go to the OR anymore. I think, being with my family, spending time at home at this point in my life takes precedence to that. So I do not do any procedures in the hospital. I have oral surgery programs in the cities that I work at. So if there's a case that needs to be done in the OR, I'll just refer them.
I'm in the process of getting the hospital privileges, but I agree with Dr. Tin that, if I see a case that, needs an OR for a procedure, then I usually send it to their residency programs.
Okay. This question has to do with COVID. What has Aspen done to help you and your patients feel safe in the office?
You want to go, Doc, or you want me to go?
Sure, I can take that. Usually like when the COVID started, everybody was scared and everybody was worried, but Aspen has done a good job. We have set the standard protocol where everybody that gets into the office, they have to wear masks, temperature checks, they have to fill out the questionnaire to make sure that, they are not having an active infection. Aspen has done a good job for providing N95s and all the PPEs. I cover 14 offices and I have not seen a single doctor or an assistant or like any support staff getting severe COVID infection. Have had few cases, but most of them are very mild.
Just to make it a point, Aspen is is Henry Schein's biggest client and biggest account. And with that comes some perks to help us practice. And during the pandemic was essential for us to continue practicing with proper PPE and N95s. So when most of the practices in the beginning were going down because they weren't able to obtain these things, we were able to have everything that we were able to continue to work safely. And it's been a benefit to be able to have that. So we never sacrifice care and we're all protected very well. And we really owe that partially to our relationship with Henry Schein.
Would you say that you saw less patients than before COVID, or are you seeing more patients now since COVID?
Since COVID started, last year actually was my best year in practice. I think there's been a 20 or 30% increase, and even this year, my first quarter has been my best quarter from my past year. So I'm seeing more patients now. I'm busier than ever, and yeah, there really hasn't been a slowdown. There's actually been an increase in an influx in patients.
What equipment does Aspen provide for you? You mentioned Henry Schein, Dr. Tin, but what would you say about the equipment that Aspen provides to you as the oral surgeon?
Is that to me or to Dr. Patel?
To you, and then we can have Dr. Patel see if there's.
I think that, well, when you start, there's an onboarding process that's involved for all oral surgeons as they start. So what ends up happening is you meet with the specialty support team where they're able to put down, like on your preference sheet, like we said, and order the things that you need. So you get monitor, you order all the equipment that you feel comfortable practicing oral surgery, hand pieces, whatever system you like to use, the instruments you like to use. You can put your own surgical kits together. I think everyone has a custom tailored surgical kit that's specific for that surgeon, because it puts in the things that they require to do their job correctly. So no two surgeons have the same thing. They might have similar things, but we're able to obtain whatever we want to make sure that we feel comfortable to do our job.
The onboarding process, they will make sure that we get all the instruments that we would prefer, including surgical handpieces, implant handpieces, anesthesia equipment, and they provide, like Aspen provides everything that we need to practice safely.
They even provide you with a backup setup in case your main surgical set or your motor on your handpiece breaks. You have another one. So and overnight, if your machine breaks, you can get a new one overnighted to you the next day and replaces it. So it's run very efficiently.
Yeah. You don't have to buy your own equipment or try to negotiate pricing or any of that. We'll provide that all to you. How do you transport your equipment and instruments from office to office?
Aspen is a great program for providing a car for surgeons. So it's a SUV with a lot of space. So I carry most of the expensive instrument with me, and the assistant carries just some of the other stuff like sterilization bags and other not very expensive stuff with them.
Do you have use of the CBCT?
So within the last 3 to 4 months or so, there's been a process where most of the offices are getting retrofitted for CBCT machines. So they're in the process now for almost, I know that at least 50 or 60% of my offices have the CareStream CBCT. And they're in the process of retrofitting more and more offices. So if you're going to be in the newer territories probably as well, those things probably are going to be part of their opening of their offices. So I would almost guarantee that you would have access to that.
Very well, Dr. Tin. And we have CBCTs in about 500 locations of the 900 that we have opened. And as Dr. Tin just stated, all the brand new offices are opening up with CBCTs, CareStream. Are you able to access patient records when you're not in an Aspen dental practice?
Yes, we have the remote system where it's a Citrix system where we can access any office's schedule and all the patient's information.
Who is seeing your follow-up patients?
Whenever we do a full mouth extraction, all the patients that we do these surgeries on are seen the next day by the general dentist. And the general dentist will, make sure that they're healing well. They check them, they adjust the dentures. And if you need be, they're always, usually if you're in the same area, you can always see them again if you had a complication, or you can always follow up with them the next time you're there. But they're always seen for sure the next day by the general dentist.
What do you do in case of a post-procedure emergency if you're not in the same office in the next day?
There's been situations where you have patients that have complications, and obviously the more surgery you do, the chances of a complication always arise, and that's part of the surgery. I've had situations where, I call my assistant and we open up an office and we go see the patient. So there's lockbox codes on the offices that allow you to have access to these locations. So if you've driven pretty far, you can also meet the patient halfway somewhere in a location that's in between you. I've done that before. But it's rare but it does happen, and you just have to plan for it and make sure that you explain to the patients that that you're able to see them if they want.
The complication is gonna happen if you operate. The more you operate, the more complications. But again, that's why the communication with the dentist in each office is very important. And as Dr. Tin mentioned, that usually if you're in the region, then you can just go to the same office, or maybe you can bring the patient to that office, and then you should be able to handle the complications. And I cover many of my offices twice a month, so I'm there every other week. So if there is any issues, then I can see them for a post-op follow-up.
Dr. Patel makes a great point, because I think that what I was trying to express is that if something happened in the night, but during the day, if there's a complication, your patients will be seen that day by the general dentist. You have this relationship with them, you call them, you discuss it, you take pictures, you FaceTime it, you do things where you're able to see it, and you can make decisions based on what you see, on what your next steps are. But you should feel lucky that you have this relationship with these dentists that are able to see these patients and help you in case you are far away. So it's actually a very big help.
Dr. Patel, how far in advance do you build out your schedule?
I built 2 months in advance. So 60 days in advance. So if I'm in March, I already opened my schedule for May and June.
Dr. Tim, would that be the same for you?
It's similar, yeah. Yeah, about a month or two in advance.
Okay. And I know, Dr. Tin, you mentioned a couple of these things earlier, but I like the way that this question was put out. What kind of support does Aspen provide for you to focus on your patients?
Well, I guess if you think about it, it's, I think Aspen's almost created a modernized approach to a private practice. And what I mean by that is we have a facility where I focus on my patients, and I have this huge gorilla sitting on my shoulder that's handling my billing. It handles my instrumentation, my malpractice. It handles everything for me to allow me to focus on surgery. So it also, what it does is it frees up your time to enjoy your life as well. Like, I like to play golf. I like to do other things besides oral surgery, which I won't necessarily be able to do if I had to focus on all those things that are being handled by Aspen. So those are all the things that Aspen does, where I work. I take care of my patients, but all those other things, like that, even an example would be, I get an email from one of the specialty support team saying, some of your DEAs might be being expired. Would you like me to help you renew them? So they're in the process of helping and looking ahead, so you don't run into a problem, so that you can just concentrate on working. So those are the things that are huge benefits to me.
Dr. Patel, anything else you want to add to that?
Yeah, Dr. Tin mentioned all the stuff like, we are surgeons, we would like to do surgery. So Aspen allows us to focus on our patient care. and give us the balanced life where on the weekends I don't have to worry about, my managers quitting or my assistants are going to leave, or if you have if someone's sick, then who's going to cover? I don't have to worry about it. If one of my assistant is on vacation or something like that, or if they get sick, then we have all these offices, regional managers will make sure that we get the manpower that we need to provide the care.
Right. You mentioned earlier, Dr. Patel, the company lease vehicle program that we offer to our full-time specialists. What are some of the advantages of full-time versus part-time employment?
Full-time provides the malpractice insurance coverage. It also provides the you can get the car. It's a great program where you don't have to worry about insurance for the car, gas, maintenance. Everything will be taken care of, and also the lease program for the car is pre-tax, so you can save some money on the taxes too. And as Dr. Tin mentioned that, DEA is all the Ohio State of Ohio has something called as a TDDD. That's almost similar to DEA. So Aspen will take care of it. Instruments, if something's broken, they can get replaced as soon as possible. And with all these multiple clinics, if we need something, we can get it as soon as possible so that the patient care doesn't suffer.
And in addition to that, we also offer medical insurance, life insurance. We offer 401k retirement. There's a lot of benefits that are available to full-time. For part-time, we still offer medical benefits, which is pretty nice, as long as you average 8 hours a week. So a lot of good benefits that Aspen Dental offers. Dr. Tin, does Aspen offer continuing education opportunities?
They do. We've gone in the past. There's been, the specialty support team will send out emails and ask, what are the things that you might be looking at in the near future that you want to learn more about? We've taken trips to, I've gone to New Jersey and did a zygomatic implant course. I've gone to California and just for Aspen surgeons where we did some classes on implants and bone grafting before. So they do offer CEs. Obviously this year with COVID, it's been a little bit different, but we actually had some implant CEs that gave us quite like 24 units of CEs just within the last 6 months. So, as things have evolved, it might be a little different, but they've always been taking proactive roles and helping us get the education we need in the areas that we would want it.
So we offer in person and obviously through the internet, and hopefully once we go back to whatever the new norm is, we'll be able to do more in-person CE opportunities. So this next question came in anonymously, and it says, real talk, how much money per day, per month? And so if you could just give me an average, Dr. Tin and Dr. Patel, what is your average production? Would you say we could use April just to kind of give them an idea
of how much my
production?
revenue? My
no,
product.
we could just talk. We could just talk about revenue, not your earnings, but your.
Okay.
Your
last month, after insurance write-offs, my net production was 550 something.
Dr. Patel, do you know that number top of your head?
Yeah, last month was 340,000. My average days are usually about between $12,000 to $15,000.
And I'd like that they shared that, because again, that's without all of the business aspect, trying to manage logistics. It's just going in and taking care of patients, and you can still make those revenue results. With communication, do you ever do lunch and learns with your general dentist and office staff?
I do. you know, we've partnered with Nobel Biocare as one of our biggest partners at Aspen, where we've done lunch and learns with Nobel. They also offer a CE program where we've had, I got my CE accreditation so I can give CE credits to the general dentist, and I've done some lunch and learns with some implant courses. We've also done it in a region where we've done it where all the doctors come together, and we've done hands-on training. So there are things out there. They're rare now. I haven't done those in a while, but there is opportunities to do that, and it is a good way to build relationships with these doctors.
Dr. Patel, anything you want to add there?
We do lunch and learns with Nobel Biocare, you know, but after the COVID, you know, things have changed, and I have less experience than Dr. Tin. So we have done some in the past, and hopefully we'll do more in future.
Awesome, awesome. And I'll just give everyone a few more minutes to type in their last few questions before we end our night. I do have one more that just came in. Do you see pediatric patients?
I don't.
I don't.
And that's just proves that that's your preference. If you want to see pediatric, you just have to let the offices know what your specific requirements are, whether it's, you know, schedule them first thing in the morning. I want to see them for a consult first, and then I'll determine if I can do the procedure. But at the end of the day, you're the treating provider, so you get to determine which patients you want to see. Let's see. What kind of insurance do you accept?
Aspen has negotiated fees for most of the insurance companies that we have, which are preset. So it's a wide variety of insurance companies: Blue Cross Blue Shield, you know, United Healthcare, you know, all those insurance companies that that Aspen has negotiated prices with. So and if there's some that there's a couple that I thought that the fees were low, and I decided not to participate, I called them and let them know, and it wasn't a problem.
Anything else, Dr. Patel, you want to add to that?
Yeah, usually we accept most of the PPOs, and depending on the region, some you know, depending on what the local companies they provide the insurances. So sometimes we also accept HMOs and stuff. So it varies by region to region.
Yep. 75% of our patients have insurance. The other 25% do not. They're fee for service. And we also offer third-party financing to our patients. So those patients, even if they have insurance, if they don't have any money set aside to pay for their treatment, we'll help them be able to afford and get the care that they need. Right. I don't see any more questions. So before we end, I just want to say thank you to our panelists, Dr. Tin and Dr. Patel, for taking this time to share with us. Thank you to the participants for all your great questions. And I want to wish everyone a great night. And thank you again for joining us.